Welcome back, Western Slope. I'm now joined by Dr. King and Dr. Working from St. Mary's Cancer Center. Thanks so much for stopping by the studio today.
Yeah, thanks for having us.
Absolutely. So talk to me a little bit about what you both do over at St. Mary's.
So I'm Dr. Work. I'm one of the medical oncologists, and I manage different types of cancers, the chemotherapy, targeted agents, and immunotherapy type medicines to treat cancer.
And Dr. King?
So I do one of the other components of oncology treatment, which is radiation oncology. So I see new patients, lots of different cancer types, and then offer them radiation treatments.
That's awesome. Now, St. Mary's is highlighting lung cancer this month. Talk to me a little bit about how prevalent lung cancer is.
So lung cancer is, can be a very devastating illness to have. It's a cancer that starts in the lung. It's all too common. We see a lot of cases each year, both nationally and locally here.
Okay.
So it's actually the leading cause of cancer-related death.
Wow.
In men and women both.
Wow. Now, what kind of symptoms should people be looking for if they think they might be at risk?
So a lot of times a cough. A lot of people might get a cough if they smoke, but a cough that's unusual or one that won't go away is a sign, particularly if there's blood in the cough. That could be a problem, right?
Yeah.
Or pain in the chest, something like that. Sometimes unexplained weight loss, decreased appetite. A lot of times what happens is a person will have a chest x-ray or something like that in the hospital, and we'll spot a lung spot and then start the workup from there.
Okay. Now, what about risk factors? I mean, I feel like smoking is a pretty obvious one, but are there other things?
Sure, yeah. Smoking is the #1 cause of lung cancers. We also here locally have, or in the region, uranium mining is a known risk factor. And asbestos exposure is another known risk factor. And then sometimes there's no identifiable risk factor, and unfortunately can still develop lung cancer.
Good to know. Okay, now what about treatments? What are people's options if they do find out that they're...
So we have lots of treatments these days, and the treatments have expanded. And of course, Dr. Work does the chemo part, and I do the radiation part. So speaking to the radiation part, we've developed more targeted treatments than ever before. And it's pretty exciting what we do. It's pretty high tech. And so, we can really zap, I guess if you're going to use that word, we can zap those tumors and be very precise now, and even take into account breathing and how tumors may move during treatment. And so there's a lot of high tech stuff that's come on. At the same time, that's kind of helped it has helped with the side effects, that we can minimize those. And I could talk about Dr. Works, but we'll let him wax eloquent on what they do.
So zapping is one option.
Right.
Yeah, and then there's a lot of new therapies from a medical standpoint that we can treat more advanced stages of lung cancer using molecular biology to target genes and things that are responsible for individual lung cancers and treat them with targeted medications for that, and or immunotherapy to use the immune system to recognize and fight off the cancer, in addition to our standard chemotherapies that we also have available.
And it's not uncommon we do that together.
Correct.
A lot of the time
Yeah,
too.
so there's an abundance of options, but you two make that decision ultimately of what's best for that patient. So you're the guys to see. Where can people find more information? Go to St. Mary's, right?
Absolutely, yes.
Make an appointment with you guys.
Sure.
Awesome. Well, thank you so much for stopping by the studio. I really appreciate your time today.
All right, thank you.
Yeah, absolutely. We'll have all this information and so much more available on westernslopennow.com, so check it out.